Hi, everybody. Welcome to week 8. You made it. You almost have another one under your belt. I'm very proud of all of you. You've done a very nice job in this course. All right. Last week's spiritual assessment papers were very well done. I was pleased with those. You guys were organized. Let me point out some things that I think confuse people. So, APA format. When you have an abstract, you should have a title page, then a page with just the abstract, and then your paper starts. And the abstract should be 100 to 120 words or less, kind of in that neighborhood. And it should be main big points of the paper. What some people didn't realize is that it does not take the place of an introductory paragraph. And APA really does require an introductory and a conclusion paragraph, okay? So in future courses, abstract by itself, one page, next page, start with an introductory paragraph and continue on with the body of your paper. Also, please look at the headings, and GCU gives you the GCU APA guidelines, that document. And just a reminder that your title, your first heading that appears in the body of your paper at the top of the page should be the same as the title of your paper. We don't use like the word introduction or anything like that. So you should have a repeat of the title of your paper as your first heading, then your introductory paragraph, then more headings and paragraphs and things like that. So just to kind of clarify, APA is kind of a big deal because we hope that one day you can maybe go on to write, to publish, to present proposals, different things like that, and nursing pretty much uses APA formatting. Okay, so nice job on those. Those were very easy to read, they were well organized, and you did a good job. So this week, our discussion questions for our final week are really about giving advice, advising people. How do we respond to people with questions? I don't know about you, but anyone who knows I'm a nurse, that means it's fair game for pretty much any healthcare question, regardless of the fact that I'm not a neurosurgeon or a dermatologist or whatever, but I do my best. The things that we need to remember is we need to stay in our scope of practice. So we can't be recommending medical treatment per se. Nursing care, general over-the-counter nursing, what would be considered nursing treatment, cool. But of course we can't be giving medicine advice. The other thing is that we can refer. That's certainly part of nursing practice. We can say we think we would recommend that you go see a such and such, or we recommend that you might want to consider going to do this. We can recommend specific providers and not get into trouble that way. We cannot make disparaging remarks about other providers. That's kind of a no-no. That gets into kind of the slander area. So you want to be very careful about how you phrase things if you are referring friends and family to providers. Just a word of caution there. And I always have carried malpractice insurance ever since I was a newly licensed nurse. There's things that we do, like advising, outside of our jobs that could maybe come back. We provide care and help friends and neighbors outside of our jobs. And I think it was last year, I have my malpractice insurance through NSO. Many people do. And it was the first time that they offered, they wanted you to provide additional, maybe it was like a rider or coverage as an educator. Usually when you renew your policy, they'll want to know if like you're a nurse practitioner or if there's anything above and beyond the regular staff nurse that you do, and that can affect what kind of coverage you might need and things like that. And that was the first year they asked about an educator. And so it was pretty inexpensive. And I did decide to go ahead and purchase that. And I think it is a good idea for educators because we do have students who want to sue. It's one of those things, and typically you're very much covered by the school, but it makes me feel a little better having that additional coverage on my own, especially since I work as an adjunct instructor, not like a full-time instructor. Okay, so that's the DQ part. You're going to be working on your CLC projects where you're looking at the health risk assessment tools. You're going to be screening or having people use the tool to screen themselves, whichever. Not patients, family, friends, acquaintances, neighbors, anybody else you'd like. And then you're going to be looking at reliability, validity, readability, how the screening results, you need to analyze them. Did they seem to represent well the risk of the individuals? How did the individuals feel about taking the assessment? What did they think about their outcome? So I need you to analyze that a little bit. And you're going to be doing a PowerPoint presentation. And just remember that there are speaker's notes at the bottom that you're going to be including. And so I'll be able to see those when I open them up and everything. So your course ends next Wednesday and Wednesday night. And then I'll be kind of grading things as they come in. That's my goal for this week. So if you submit yours early, no pressure, but if your team submits it early, I will try to grade it early. And I usually try to have grades done within like 3 or 4 days once the class ends. That's my goal. I know you guys are waiting for them and you're on to other courses and stuff like that. So that is my goal. And I'm looking forward to spending the final week with you in the main forum. I hope it's a good last week. See you then.